morning, everyone. My name is Lynne Feldman. I'm the Associate Executive Director at LifePath. Meg and I are going to present a little bit today about expanding the stakeholder universe. I'll let her introduce herself in just a minute. First, just a little bit about LifePath. We're the Area Agency on Aging and the Aging Services Access Point for Franklin County and North Quabbin, but we also provide services all throughout Central and Western Mass. We're a nonprofit organization serving older people, people with disabilities, and caregivers.
So I'm Meg Ryan, and I'm a public health nurse for a cooperative public health district in Franklin County. I serve 15 towns, and they're basically the 15 smallest and most rural towns in the state. The agency itself does a lot of the planning for the region, so we work closely with LifePath about a lot of things. But one of the issues, of course, is our aging population, which is great. We're living longer and healthier lives. But as a public health nurse, I need to pay a lot of attention to that. So that's why we're partnering with LifePath to work on age and dementia-friendly Franklin County and North Quabbin.
So just a little bit more about the project. An age-friendly community, as you know, is a place that is welcoming and livable for older residents and people of all ages. LifePath, together with FERCOG, is leading an initiative towards helping the North Quabbin and Franklin County become more age and dementia friendly. We started this planning process in 2020, and that included signing on 27 individual communities to become age friendly, conducting a comprehensive needs assessment that touched over 2,000 individuals, and finally completing an age and dementia friendly action plan, which was released last year. If you're not familiar, an action plan is a comprehensive strategy developed by a community for a community to ensure that its infrastructure, services, and policies are all designed and implemented in a way that supports and accommodates the needs in people of all ages, particularly older adults. And I'm excited to announce that we have recently been funded by both the Massachusetts Community Health and Healthy Aging Funds, as well as Point 32 Health Plan Foundation, to implement the action plan.
So our goal here today is to look at stakeholder engagement and how we can expand the number of diverse people and communities that we engage with when we do work. To really make something sustainable and permanent, you need to involve the entire community. So that's our goal. I want to just say a brief note about the word stakeholder. For some people, the word can actually be problematic. It has some colonial connotations. When the European settlers arrived, they could drive stakes in the ground and claim it, and displacing indigenous people. That can feel disrespectful and perpetuate that feeling of colonization for some people. It also overlooks power dynamics. It assumes that all stakeholders have an equal share or stake in what's happening, and that's usually not true. Some people, there's an imbalance of power most of the time. So if we really want to be inclusive about the people we're engaging with, we need to be very mindful about our use of language. And I'm not here to be the police about language, but just think about the terms we're using. Other terms to consider could be collaborator or partner, affected party, relevant or interested parties. Or you could just use the term for their actual role: community member, resident, older person. So let's look a little more deeply at why including traditionally marginalized or overlooked group leads to better decision-making and more sustainable and robust outcomes. Including priority populations that are most affected or experience inequities more than the others, includes a wider range of the experience. That diversity brings an enhanced perspective. By engaging with a wider range of voices, we ensure that our decisions are informed by more diverse lived experiences. It leads to better and more creative problem solving and the ability to anticipate a much broader range of the potential challenges and opportunities. You can really mitigate a lot of blind spots by including a wider range of people. Centering people with lived experience of inequities and inviting them to share decision-making as I said, leads to better solutions because it can be specific to the communities that are within our communities. Examples of those people with lived experience can be low-income people, LGBTQ, people of racial or ethnic minorities, people with disabilities, older adults, unhoused people. You can keep going for quite a while. Bringing those diverse sectors together and working across our silos is also important. No partner can solve a community-wide problem by themselves. It takes the entire community. So bringing together the people who have the power and the ability to make decisions and fund them, such as municipal leaders or leaders of human service organizations, with those who will be affected by those decisions, can really make a decision and process stronger. Service organizations often have connections to people with lived experience. Think about our aging services access points like LifePath, fuel assistance, housing groups, councils on aging, any number of different places. Including people who have been traditionally marginalized in a meaningful way can really increase community buy-in and trust. If you include people from the very beginning, from that moment of surveying what the needs are of your community, we're all more likely to feel ownership over the outcomes. It fosters trust and cooperation. I want to point out that building relationships like this is always slower than you think it's going to be. But you need to sit down with people and keep listening. Understand what people's barriers actually are before you start trying to identify solutions. Don't be that person that decides, we need thing A, when actually B is the problem. It makes it sustainable, building those coalitions and partnerships. Also, it can really demonstrate to potential funders that there's a lot of community support, another added benefit. Just want to say another note about being mindful of the burden on people from more minority populations, especially in small and rural areas like the area that we serve. There are often very few people of color, very few people who identify a certain way. And sometimes that one person ends up being asked to do the survey, to participate in this group and this group and this group. So just be mindful of what you're asking and the potential level of exhaustion for that person. The photos are people who are attending a health equity training that our age and dementia friendly group ran, and some ideas on housing from a listening session. I just wanted to give an example of ways that you can extend your partnerships and work out of your silos. This is not specifically age and dementia friendly, but very relevant. I think we're all aware that there is a real crisis in primary care providers. There just aren't enough. And it feels a whole lot worse in very rural areas than it does in more urban areas. Bay State Franklin Medical Center, the community hospital in Greenfield, started a family medicine residency 3 years ago. And so to support these doctors, data shows that about 80% of doctors will stay to live and work where they do their residency. So having that residency, we're hoping for that magic cure. Or at least to improve it somewhat. So FERCOG, Community Health Department, decided to run a bus tour. We get all the residents together when they start in July, and we put them on a bus and we drive them around and we introduce them to people who work with the population of people they're going to work with, and show them some of the distances that their patients are going to have to drive. Yes, it actually does take 45 minutes for your person to get to your office. And no, there's not a doctor closer than that. So there's twofold. Introduce them to the area, and it's an overt hard sell about what a great area it is to live. So the people on the bus share their favorite restaurants, their favorite music venues, their favorite hikes, activities. We always stop and get ice cream. But we also talk to a range of people. The photo on the bottom left is the residents talking with Mary King from the Montague Catholic Social Ministries about the work that they do in Turner's Falls with South American immigrants. The top right is Zach Barrio at Baker Pharmacy in Shelburne Falls, a independent pharmacy, giving the doctors some tips on some of the issues that are going to come up for their patients with refilling prescriptions and how to deal with some of the insurance, stuff they don't learn in medical school. And present on the bus, we had people from the FERCOG. We had the executive director of LifePath. We had the executive director of the Community Health Center of Franklin County, the director of community health at FERCOG, public health nurse, the director of Chamber of Commerce in the area wants to be a regular but couldn't come this year. These are not people that sit down in a room together very often. So think about who you might know that you don't usually work with as you look to find a wider range of stakeholders to work with.
Great pictures, Meg. Thanks for that. That looked like a great way to get people connecting with each other out in the community.
It's fun, too. We get more people who want to go every year.
Yeah, I'd like to go. Ice cream,
We'll get a bigger bus. You can
come. So inclusivity. We periodically, with the Age and Dementia Friendly Steering Committee, will have an agenda item to talk about inclusivity, especially when we have open seats. We're looking to recruit new members. And the idea is to reflect upon who is on this group and who is missing. And having a brainstorm about that helps us identify people that might be missing and ways that we might be able to become more inclusive. Here's another little tool that we'll sometimes use. And thanks to Meg for reminding me about this tool, the racial justice reframing questions. So when looking at the membership or key decisions, asking these questions, who has input, who decides, who benefits, who is harmed, and what are the unintended consequences, is a good filter to run your decision making through to make sure that you are being inclusive. And they can help mitigate our lack of knowledge about who might be overlooked by considering decisions from a wider perspective. And the overall goal with inclusivity is to try to make the people who will be making the decisions the same ones, the extent it's possible, that will be affected most by those decisions. Here's another tool that we have used, methods for assessing whether current stakeholder engagement is truly inclusive, whether that be your steering committee, your board, or your work groups, or your social media followers, or anybody that you might be engaging with. This is just a simple stakeholder mapping tool. So the way it would work would be on the x-axis, you have people who have low interest in what your group is doing, and the right would be high interest, so as in people who are affected by the decisions that you're making. So say you're on a select board, you would look at that axis in terms of how people are affected by the decisions that you're making. And up and down are high impact and low impact, as in the people who tend to be represented on that select board, and as the people who tend to be missing from those select boards. And identifying, putting certain folks in those groups. And you're really looking for particularly the people who have high interest at low impact, that bottom right quadrant, as being targets particularly for community engagement, and identifying ways that you might be able to connect with those folks a bit better. And also just gives you kind of a perspective. It's not always going to be perfect, and as Meg said, it can be challenging to do community engagement with every group that you'd like to do and have all the voices represented. But having intentionality about it and using tools like this is helpful. You can also consider using public data to identify your priority population, see who's living in your community, and if there are groups that you don't yet have connection with. There's a lot of immigration happening, and you may have new groups coming into your community that are not familiar to you, that you're not aware of. Some tools that you can look to for information is the Community Health Needs Assessment, the CHNAS. Those are done every 3 years. It can be helpful in understanding those priority populations, or the State Department of Public Health data. I can follow up with some links to these tools if you're interested. And there's also the data is a little bit out of date at this point, but the Healthy Aging reports show town by town exactly what is going on from a health perspective in those communities. Okay, so what we would like to do at this point is we'd like to encourage a little bit of discussion at your tables. Just take 5 minutes or so. What we want to do is give you an opportunity to think a little bit about the stakeholders within your organization and who's making the decision. So the question is, who are those stakeholders in your organization's current decision-making processes, and who might you be intentionally overlooking? So we'll just break for 5 minutes, and Meg and I are going to just come visit your tables, and then we'll resume and talk a little bit more about some other ways that you might be able to do some community engagement with those folks and ways stakeholders can participate. All right, thank you all so much for engaging in a little brainstorming about inclusivity within your groups. We want to talk a little bit about solutions to, once you've identified your groups, talking about ways that stakeholders can participate with you in your activities. One helpful thing would be to create a list of all the ways that a stakeholder could be involved. For our project, when we made that list, it looked like steering committee member, work group member or leader, people who attend events, people who are on the mailing list, people who follow us on social media, people who answer surveys, or people who participate in focus groups. And think of these opportunities in light of the continuum of community engagement, communicating clearly about what you're asking for. These photos are from a listening session by Age-Friendly Work Group in Buckland, and this was an event that Meg helped organize, but one of the ways that we were able to get such great attendance is by offering free ice cream. So there's always a benefit to thinking about like how you might be able to fill those seats and engage people and get them interested and focused on the work that you are doing and gathering input from those folks. Once you have a list of folks that you want to engage, at our table we talked about people from the Spanish-speaking community for one group as being an important target. There's an outreach plan that you could think about creating for each group, or maybe a selection of the groups that you're trying to reach. And there's kind of a process that we have followed to try to, have some success with gaining inroads with those groups. So really doing your homework, really understanding these folks' contexts, understanding their communities, needs, and challenges. This will help you kind of tailor your approach in a way that feels relevant and respectful. And then leverage your existing networks. So Meg mentioned the brick house. Was it brick house that was in that photo? Montague Catholic Social Ministries. So for us, we've worked with the Brick House in Turner's Falls, but they're both organizations that are very supportive of people in our target communities. In this case, specifically Spanish-speaking communities. So they would be what's called a trusted intermediary. That could be a single individual community leader, an advocacy group, social worker, community health worker, who already have strong relationships with these stakeholders and can help facilitate introductions. So you might be, rather than inviting Spanish-speaking residents directly to your events, you might instead be partnering with an organization that works with Spanish-speaking folks together to host an event. And then you want to make sure that whoever that organization is, you're doing something for them to benefit their goals as well. So you're going to show up and you're going to bring all the refreshments to this event, for example, or whatever you're going to do to make it worth their time. Second, we suggest tailoring your communication approach using culturally appropriate methods, whether that be in-person meetings or community events or social media or multilingual outreach materials that have been translated. Usually it's a combination of those things, but understanding how a particular community prefers to meet. So for example, if you're working with a faith-based community, you might consider doing an in-person event after their services or as part of their regularly scheduled activities. And another important suggestion that I would make is to really simplify your message. Make sure that your materials and your outreach and what you're saying clearly explains why their involvement matters and what impact they would have. And you really want to avoid jargon or any kind of technical language. Really boil that language down to make it easy, that you're not asking someone to put a lot of effort into reading your material or learning a new set of buzzwords or something like that you use within your project. And that can happen by accident. I know it's not intentional. We do it all the time. In fact, one of our steering committee members recently said to me, sometimes you guys use a little jargon in the meetings and I feel left out. And that was really helpful feedback for us to hear. Even though we work on this all the time, we're still learning and trying to improve and be better. Number 3, build trust and relationships. So again, start with listening before asking someone for input or anything. Listen to concerns and experiences, hold listening sessions or focus groups to demonstrate their voices matter, and demonstrate your commitment. Just, showing that you're serious about long-term engagement. You're not just in and out to get what you need and then you'll never to be seen or heard from again. And that explaining specifically at that initial engagement how you're going to continue to be involved and what they can expect for the future. Offer incentives. We talked about ice cream.
Food is great.
Food works, but also transportation, childcare, stipends, food during meetings. So as you're writing your grant budgets, please remember to include this in your proposals, because this will really help you. Having this kind of ability to provide incentives will be really helpful in getting people into those seats and providing some value for their time and meeting folks where they are. So again, being flexible in terms of location. For example, we, during our needs assessment, we held focus groups for residents of low income at subsidized senior housing in multiple locations. So we went to them with the focus groups. In another case, we had someone who needed a ride, and we arranged that to an LGBTQ focus group. And then finally, inclusive spaces for dialogue. So really ensuring, for example, accessibility, making sure that your process is inclusive by providing interpretation services, using accessible venues, and always considering the needs of people with disabilities. Make sure your social media and website are friendly to people with low vision. These are all things that we know we've heard before, but I want to make sure to state it in light of the context of inclusivity, of decision-making and impact. And then safe spaces, create environments where participants feel safe to express their views without judgment or retaliation. One tip for this would be to just start with a group agreement or the ground rules for a group before you get started on a meeting and get off on your tangent. Just explain what's expected of folks and how people can expect to feel as part of that event that day. So we have another follow-up group discussion question. So you all were talking a little bit about those stakeholder groups that you're having trouble cracking into. So I want to encourage you to talk a little bit more about specific challenges or barriers that you faced in engaging those marginalized stakeholders and how we might overcome them. We're going to come back after just a few minutes of talking, and that will be kind of our wrap-up, and we'll have a Q&A. But I think Antron gave us a little extra time, so we have about 5 minutes now to do some additional discussion around this. Thank you all so much for participating. I just made a slide of sort of the key takeaways of our discussion today. I won't read them to you, but when you get the materials, you'll have this as a guide if you'd like. I just want to open it up if anybody has any comments or questions from your group discussion, your experience relevant to what we're talking about that you'd like to share.
I actually want to ask Brett to make the comment that he just made.
So oftentimes the lack of follow-up on a survey, or the lack of, I've taken 3 surveys and I haven't seen anything change, is kind of the biggest barrier for engaging folks further. So, putting some follow-up with a survey, even if it's, hey, here's the findings, would really be beneficial to keep folks engaged.
I think we forget that sometimes. We talked a lot about survey fatigue over at our table. So.
Well, and budgets too. So if we have a
budgets.
contract that might not really allow for a ton of community engagement or follow-up because you've got to move on to the next project. So it's it's definitely challenging.
I think continuum of engagement is important. And I was saying, as a planning agency, a lot of our projects have a year-long time frame. And so there's not the time to develop relationships and, build the trust and all of that. So to get participation from marginalized communities, it's just like a one-off listening session for a report that's in one language, is really difficult. So I come at this as a planner into the public health world, which I think is a lot more, has a lot more consideration
It is helpful to think on a longer time horizon sometimes, not just for this plan, but the one that's going to have to be done in 2029. Like that might take that long to build enough strength in those relationships to have that group feel really connected and have an influence over what is being decided in those plans. But the point is to keep going.
I also think being really clear about, with the people you're trying to engage with, about where you are on the continuum of engagement is important. Are you just looking to be informed by their experience? Don't forget to inform them back, like Brett. Or are you looking to really collaborate with them to have them help you decide on a thing? So just being really clear with yourself and with the people you're trying to engage with, what your ask is. What is your ask? And follow through with that.
I thought this was a really good opportunity, too, for us at this table and hopefully others to think about the groups that are sort of often outside of the scope of funders, for example, that's often how we kind of tailor our thinking to what resources we have available to serve. And we talked about incarcerated folks, we talked about First Nation tribes, and those, I think, in terms of programs and services that are often, that we have the ability to leverage, those are groups that sometimes are just not included in the populations we serve, but they still live there and are there. And so even if there's not an easy answer for how to be inclusive in a proper and full sense, but even just to think about and to take the time to think about, even the groups that are, maybe, a few layers or that have significant barriers to cross before they could sort of be part of programming or be part of, a group that would be served, as they should be. But anyway, just to take the time to think, have these conversations is important, even if you don't have the solution at your fingertips.
Okay, well, I want to thank Antron and AARP for inviting us today to present. Thank all of you for your kind attention and your discussion. Look forward to the rest of today's discussion and enjoy the morning.
Thank you very much.